Hello, today is Wednesday, October 4th. Welcome back to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen to find out how pharmacists and pharmacy students like me can improve population health equity, and patient care through advocacy and education. My name is Jiwoo Lee, and I am a final year pharmacy student at the University of Rhode Island, working with the Rhode Island Department of Health with my professor and preceptor, Dr. Bratberg.
Howdy, and I'm Jeff Bratberg. I'm the clinical professor of pharmacy practice and clinical research at the College of Pharmacy and the academic collaborations officer at the Rhode Island Department of Health. Just a reminder to our listeners, the opinions expressed in this podcast by us don't represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
Today, we have a very interesting topic that might pique the interest of new and current college students. For anyone over the age of 18, HPV vaccination in young adult and college students. HPV is the most common sexually transmitted infection in the world. It's responsible for a range of now vaccine-preventable health issues such as cervical cancer, genital warts, and cancer of the throat, anus, and genital areas. The best way to think about HPV vaccine is that it prevents cancer, just as the hepatitis B vaccine prevents liver cancer. It's safe, effective, studied in millions of adolescents and adults, and while it doesn't prevent all HPV infections, it dramatically reduces the most severe consequences of infection. Dr. Bratberg, could you provide our listeners with an overview on HPV vaccination and why it's especially important in college students?
Yeah, that's a great question. Typically we focus on adolescents for HPV vaccine. It's in that required schedule, but it's been expanded for sort of anyone at risk of HPV. So there are people who come to college as 18 to whatever year olds, and if they weren't vaccinated previously, college is a great time to catch up. College students are at a stage in life where they're more likely to become increasingly sexually active, which may increase their exposure to HPV. Studies have found that college-age women have the highest prevalence of HPV infection, but all people, regardless of gender or their sexual activity, should be vaccinated to protect themselves. So the CDC, which is the Centers for Disease Control and Prevention, has an advisory committee on immunization practices, or ACIP. And again, we said earlier, their optimum age of vaccination is actually 11 to 12-year-olds, and they only need 2 doses there, and it lasts a lifetime, has a great response. But not all people get that, right? There's resistance, maybe it's missed, maybe people move, even though all registries are state-based, and so they may not know that they got it or not. So it's 11 to 12 because the best time to be protected is before people become sexually active and their increase of exposure occurs. HPV, it's important to know, can be acquired from surfaces, the environment, but the higher risk strains are typically sexually transmitted, and the higher risk of cancers, I should say, or genital warts. So although the vaccine does have this greatest efficacy and works longer at younger ages, anyone from ages 16 to 44 can protect themselves and their partners by completing the 3-dose series.
Surprisingly, HPV immunization rates in college students are surprisingly below U.S. Department of Health goals, which is having 4 of 5 females and males be vaccinated by 13 to 15 years old, but less than 3 of 5 have done so. As college students, we have access to healthcare resources such as health services. I go all the time. While it may differ by state, the University of Rhode Island provides free HPV vaccination provided by the state at health services. For information on how you can get the vaccine, please reach out to your clinic nearby or school health services. So, great. We're going to jump into why HPV vaccination is necessary and when and where college students can have access to them. So we're just going to dive into questions that one might have on HPV vaccinations. Dr. Bratberg?
Okay, so, what would be the reason? So you said that, we want like 80%, so 4 out of 5 females and males be vaccinated. We're achieving that in Rhode Island by 15 years old. Only 3 of 5 have done so. So there's people who come to the university, whether they're from Rhode Island or not, where we have a mandate to be vaccinated by that time. There's still significantly number of people who are unprotected. Mm-hmm. So what would be the reason, and we mentioned them a little earlier, why some people might not get the HPV vaccine?
That's a very good question that I cannot give you a definite answer to, because there are various things we have to consider, and the main reasons would be lack of knowledge and stigma is what's going on. So in terms of knowledge, it is important for college students to be aware of their high risk of becoming infected with the virus. So according to a survey conducted in 2021 on knowledge, beliefs, and practices among U.S. college students concerning HPV vaccine, HPV vaccinated students showed higher levels of HPV knowledge. So fun fact. It is also important to mention the current stigmas that associate with HPV vaccine with sexual activity and promiscuity among parents. Some parents fear that receiving HPV vaccines will actually increase the likelihood of their child's sexual activity, which is not true. Not true at all. What do you think, Dr. Bradberg?
Yeah, it's understandable. G and I were just at my lecture on harm reduction and sort of the idea of moral hazard. It seems that we started this podcast by saying if we think of HPV as a cancer prevention vaccine, and I know the companies that make these vaccines, usually advertise that nobody wants their child to have cancer, so protecting them from it should be the main goal. But because those high risk strains do cause cervical and other genital cancers, and they do cause genital warts, it's often associated with sexual activity. But I always say, I always had this thing where, why don't we put giant posters of cancers and genital warts on the quad and say, is this something that you want, or is this something you want to prevent? Clearly those with knowledge are getting prevention, and the knowledge is staying with them. We have this vaccination as just part of a whole series of education and knowledge and attitudes for safer sex practices in general, but also just protect yourself from cancer, right? And so I think it can go both ways. It's just an element of comprehensive sex education, but also just an element of other adolescent vaccines. We give Tdap, we give meningococcal vaccine as adolescents. Adolescents get flu vaccine and COVID annual vaccines every year. And so I think we just sort of say these are the things that are recommended, and these are safe and effective, and here we go.
There you go. You're vaccinating from cancer, not from sexual activity.
Exactly, yeah.
Yeah, we have to really remember. So from a public health perspective, what would be the best way to increase HPV vaccination rates in college students based on the previous question, Dr. Rutberg?
Yeah, so if we, we can't overinterpret the science that if those who are vaccinated have more knowledge, does it go the other way? But I still think we're not losing by educating people and making people aware and reducing barriers. Public health is about your perception of it, but it also is access. I talk about flu vaccine and say, okay, there's a flu vaccine clinic happening at Health Services. There's actually several happening. There's one happening in our building, a previous podcast. So if you walk by and you say, I need to get vaccinated, you have to have at least a little bit of knowledge to go, yep, I'm going to get this vaccine, my arm's going to hurt, I'm going to maybe feel bad the next day, but I'll be protected against influenza, and that's what I want. Same thing for HPV, that some people think it's only women who are affected by HPV. We've got to protect all people. Safety data exists for men and efficacy data, so we need to emphasize cancer prevention among all genders. We can talk about health outcomes. Again, we mentioned that earlier. Make it part of the standard conversation in a consensual and science-based manner. So when people say, I want to know how to be safe in my relationships, if they're sexual, HPV vaccination, checking up on that would be important too. And yeah, accessibility. So in Rhode Island, these vaccines are offered for free. They're offered on campus. You can get them at pharmacies. And so I think setting that up, and because we're in sort of fall vaccine season for adults, add on HPV, but then make sure that you're going back for those other two visits, and I think that's the things that we need to do.
Right. So self-awareness, obviously, and also accessibility are the big main two things. So how do pharmacists play a role in HPV vaccination and public health, would you say?
I mean, pharmacists are healthcare providers, and they are the prime vaccinators here. Again, we may not be vaccinating, and Rhode Island pharmacists cannot give adolescent vaccines yet. I'm sure we could. The more people that can provide these vaccines, the more you can. Again, for college students, yes, you can do it. So we're not really in that adolescent mode, but for college students or any adult who is not vaccinated, recommend it, offer it, or at least plant the seed. They may come in for their flu vaccine or their COVID vaccine, and you could say, hey, what other vaccines do you need? Or passively ask. And there's still stigma. We can't just eliminate it through a minute conversation or even a 10-minute conversation, but just say, hey, here's some pamphlets. Here are the vaccines. You're this age and you have these, chronic diseases. all of those materials exist. So just giving people the information so that they can come back and go, hey, can I come in Friday to get my first HPV shot? And we can say, sure. So we mentioned the COVID vaccine and the COVID pandemic. According to a Planned Parenthood study, there was actually a concerning amount of decreased vaccination rates due to the pandemic. Again, probably because this is not a typical community pharmacy vaccine. Adolescents, again, didn't go to their clinics. Their doctor's offices were closed. And even though pharmacists were able to, via federal government intervention, to give COVID vaccines and other vaccines to adolescents, that was what they were doing, not HPV. So we're in even a greater perspective here, is that we're sort of 3 years out. These are going to be college students soon. They may have missed HPV. They may not be getting caught up. This is a great opportunity for people listening to say, what are my records? What do I need to do? What do my parents want? Patients and parents will have questions, whether their child is an adult or a college student or not. What do you think, G, about education and knowledge?
I think pharmacists, like you said, play a really critical role in terms of education and really helping out the patients, because pharmacists working in like community settings too can always make sure that HPV vaccines are readily available in order to reduce barriers to access. And also, a lot of insurance companies actually don't cover HPV vaccines, so it is important for pharmacists as the most accessible healthcare providers to really navigate these patients to available resources such as Planned Parenthood for all these like patients to be able to have access to the right healthcare. Dr. Bradberg, as a parent of two amazing children, a pharmacy professor, and a public health expert, what message would you like to leave your listeners with regarding to this vaccination?
So there's always 3 levels or maybe 4 levels that you can intervene. You can make sure you're protected, right? You can make sure that your family members are aware and perhaps protected at whatever age they have. My kids have gotten, will or have get. My 10 and 12-year-old will get HPV vaccinated. They're 2 doses. They're under 15. And then think about the population, right? The more people that are protected, the more knowledge they have, and the more awareness of how they can keep themselves healthy for vaccines against HPV, but just maybe vaccines in general. G, as a student, as an amazing student, while we're using that word, at the University of Rhode Island College of Pharmacy, what would you leave the listeners with from your perspective?
I just want to say that we're all adults here, so we have the right to make the right decisions for our own body, especially health decisions. So we should be able to do that, and we should be mindful of that too. And we should be also more open to talk about sexual health issues and really not judge others for doing so. We want to make sure that these our friends and people around us and ourselves are getting the right treatment necessary with sexual health issues. Also, I want to say that we need to really utilize student health care services on campus. We have it accessible 24/7. So make sure you get your routine checkup for sexual transmitted diseases, whether you are sexually active or not. Very important. And also, prevention is also self-care, not just, like getting your nails done or like getting a mask pack. Prevention. Get vaccinated. That's a part of your own health self-care too. And please check your vaccination status and make an appointment to start your HPV series today.
Sounds like great advice. That's all we have for today. We hope you enjoyed our conversation and found it both informative and maybe a little bit entertaining.
If you enjoyed today's episode, please take a moment to subscribe, rate, and review us on your favorite podcast platform. Your feedback helps us reach more listeners and continue to produce great content.
And if you have suggestions for future topics or guests you'd like to hear from, don't hesitate to reach us out on social media at PharmDPubHealth. That's at PharmPub, like public, and then health, HEALTH, at PharmDPubHealth on Instagram and Twitter and LinkedIn and YouTube. So we're on. Hello, YouTube listeners, and waving to the camera. We always love hearing from our audience. Subscribe and rate and share.
Thank you for listening, and we can't wait to have you back with us on the next episode of The Regimen.